Welcome, everyone. My name is Sue Ann Hauser. I'm one of the educational consultants with the Patent Network. My colleagues Tara Kelly, Jennifer Craig, and Erin Campion are also with us today. Thank you for coming to this installment of Hour with the Expert. This afternoon, we have with us Dr. Kimberly Mathos, who is going to talk with us about prevention and intervention measures to support student mental health. And I know we only have an hour, so I'm going to turn it over to Kim and let her take it from here, and know that she comes with an multitude and wealth of experience and expertise in the field of mental health. Dr. Mathos.
Oh, thank you. I don't know, is my camera on? Yeah, right? Okay. Sue, I want to thank Patan and Sue Ann, particularly. She is a very collaboratively spirited lady, and been fun to sort of be involved in her world and the way she thinks collaboratively and so forth. So I'm a psychiatrist. I work at the University of Pittsburgh, but I like to consult at different places where deaf, blind, and hard of hearing people go to school or interface and so forth. So it's been a passion of mine for a long time in this particular population. But I'm actually, like, my email and stuff is University of Pittsburgh. And so, you know, that's kind of my home. And I'm going to talk today about a whole bunch of different topics, but I want to talk about how COVID has changed the landscape of mental health, because it's been one of those things in your lifetime as well as mine that it's going to be like change the world. I think, you know, both in the way people do conferencing, the way people aren't driving to Harrisburg probably anytime soon, the way that we do mental health delivery. And, you know, there's pluses and minuses for sure, but nonetheless change. So I'm going to focus a little bit on that, but I'm always willing to go off on any topic because that's the way my brain works. But here's what I sort of set out that I would talk about. This concept of wellness, resiliency and wellness is an important topic that we didn't used to talk about 30 years ago. So I'm going to spend a minute on that. Oops, not quite yet. Then we'll talk a little bit about some common mental health issues that you might encounter, like what types of mental health conditions that you might see. We'll go through that list in a second. How do you, as a teacher, promote emotional well-being, both for your own self in these crazy times, as well as for the kids you serve, who might be even more particularly at risk than as compared to kids without some of the challenges that our kids have? And then the topic of how I decrease stigma. You know, even though you're a teacher and you're not in the world of mental health necessarily, there's lots you can do to make the world an easier place to access and talk about emotions and make it okay to discuss. And I'll share a few of my parents were both teachers, so I'm kind of interested in these kind of things. And I have a teenage daughter, so I'm gonna she'll probably never, please don't, if you know me, tell her that I talk about her, but she has some interesting physics teacher who does some really innovative mental health ideas. And though he's a bit of a nerd, he has his act together in some interesting ideas that I'm going to share with you a little bit about decreasing stigma and kind of making it okay to talk about emotions. And then a little bit about like where to refer people. And I guess everybody's from all over Pennsylvania, right? So telehealth has really kind of changed the landscape of where it's okay to go for care, because it really doesn't matter where you live, except for there is this issue of the insurance companies. And so they have their boundaries, but there have been an increasing number of entities that serve culturally deaf people anyway in other states who have really rallied with the insurance companies to try to get telehealth served from, you know, Virginia to here, from the DC area to all over creation, and they've been really effective in doing so. So I think, and for other special populations too, I think it's important that specialty providers and consultants figure out a way to network to serve the needs of people both mental health wise, assistive technology wise. And I don't know, I hope I remember to get back into it, but friends with some folks at Helen Keller, and they've, you wouldn't think, been able to do their services remotely, but a hybrid model of trying to figure out a way to meet the needs of people who local people sometimes don't know where to begin. And then we'll talk, if we have time, a little bit about some case studies, but honest to goodness, if we don't stay on topic, I don't care. I just kind of wanted to have a little bit of an outline because Sue Ann said that was important. So I'm following her words of wisdom. So then we are going to move on to wellness. Yes. So I'm 57, and when I was young in my residency as a psychiatrist, we didn't really talk about wellness, and in our parents' generation too, we didn't really talk a little bit about mental health. We talked more about mental health, like you have mental health problems rather than one's mental health or wellness. So now there's a lot more conversation in the last 25 years ago for mental health, with what you call that when you elevate your, at the end of the word, that gives uplifting mental health, thinking about like what you can do to decrease stress, what you can do about feeling balanced and well, and handling stressors, taking a day off, or rewarding yourself by a shopping spree after you had finals, or after you've graded papers, to go to Ross Park Mall or something and spend a couple $100 on yourself. Those kind of things in the time of COVID are really important, So this is something that is something that hopefully we'll talk about and openly chat about and think about together. Then there's the issue of also, it used to be that people used to almost think of the mind and body as being unconnected, as if the neck didn't exist. But we're going to, of course, working with deaf and deafblind and hard of hearing kids, have issues where people's medical conditions definitely impact their mental health, whether it's because they have thyroid disease and get anxious, or whether they have glycogen storage disease and they get tired, or, these kind of issues. There's definitely a connection between mind and body. But the concept of wellness is something that, I think as a collective community, we can look out for each other and kind of try to make sure that none of us is too burdened, So then we'll talk on the next slide. So why might our kids be at risk? The kids that we serve, being deaf children, hard of hearing children, and children who are deafblind or blind. So it's notably evident in the research that kids that have sensory disabilities feel alone more often. There was one kid that just terrible, mean things that kids can say to bullies and so forth. One kid that was deaf that had acne one time, his peers unfortunately called him Deaf Leopard, just really mean, and other people that are that come and talk a little bit about how they feel just not included in the lunchroom, or even if they sit near somebody, they don't necessarily feel a part of the group. And that social isolation is really an important thing to try to figure out together with a child, or thinking together about how to solve the problem. Also, if a kid has hearing differences in any kind of way, or if they're blind, academic performance might not be so easy. There might be challenges therein that frustrate a child or make them overwhelmed or feel depressed. And, that's something that we want to be on top of. I know Ms. Hauser is really trying to rally to make a few more psychologists competent at working with individuals who have sensory differences. So one of the challenges too is identifying kids that have learning disabilities in our state, to be sure that they actually get placed with the appropriate supports. And that's a challenge too. But if a child is struggling academically, that's certainly not good for their mental health, One of the things that we'll talk about a little bit more in depth is the issue of what happened. We're on and off, and I'm not sure what percent of schools in Pennsylvania are doing Zoom versus home, and a hybrid model here and there. But some kids are better at Zoom. Some kids are definitely better at in person. So unfortunately, we have to figure out how to do both places for a child, or how to teach them to self-advocate for a learning environment that works for them. Another thing that puts kids that we serve at risk is that, say, whatever caused the child to have a hearing difference or blindness, it potentially could happen that that same condition led them to develop like learning disabilities or attention deficit disorder. Like, for example, if a child had meningitis lung and they lost their hearing, it can happen that kids develop attention deficit disorder from that, or that they have learning disabilities. And some of those in utero infections that caused deafness back in the day when rubella was common, or even cytomegalovirus now, some of those conditions of those kind of infectious etiologies of deafness sometimes put kids at risk of attentional issues or learning disability issues, or even autism. And so in addition to having deafness or blindness or whatever, sometimes these other conditions can happen too as a result of that incident. Another thing that puts kids at risk is that no matter how hard a parent might try, there's probably differences in the way that child is raised compared to their other children that don't have those challenges. Either the parent might be overindulgent, or they might be really hard on that child, or they might not even try to communicate with that child or ignore them. And then if there's interpersonal stuff between the parents, or if there's one parent or whatever, there's all that dynamic that can impact the child's development and growing up and put them at risk of having mental health related issues. And then, of course, communication is huge. You know, that if a child doesn't communicate with their parents or with their peers, well, whether they're hard of hearing or culturally deaf or blind and don't see people in their environment, that communication and solitude is certainly not good for a person's mental health. So those are all kind of risk factors that our children uniquely encounter. And then we'll move on to what mental health issues might I encounter. So an interesting thing that I've always inclined to talk about, and it's always kind of fascinating to me, is sometimes when a child is deaf, the parent might have profound depression, yet they think because the child's deaf, they're not like them genetically in other ways. So they forget to mention maybe that they've had thyroid disease, or that they've had prominent suicidal ideation, or that they've had anxiety so bad, you know, that they almost ran the car off the road, you know. So sometimes there's that need to remind people about any anxiety in the family unit, like when I'm talking to them and so forth. I mean, that might not be something you really get into at school, but those kind of genetic risk factors exist for mental health problems too. So that if a parent has major depression, the child who already has risk factors because of peer problems might inherit this also tendency to have major depression from their family member. And so together they're more inclined to maybe have depression, which doesn't mean they will develop depression, but it means that these guys come with some things that we need to boost them up. We need to create more resiliency for them. So we talked a little bit about the need for kind of doing something about communication barriers and peer relations and adjustment to both for the child as well as for the parents, a little bit of a change in dreams sometimes. The child's losing their vision and everybody around them's getting their driver's license. That's a real bummer for the kid who's not able to ever attain that dream. Some kids might not be able to go away to school financially or just geographically, or they can't not have some sort of support that currently exists, that they might not be able to make it on their own. So these kind of things all are things to keep track of as the child matures. So it's not like a one and done kind of situation as far as mental health risk factors. As a child develops and meets these little milestones and normative kind of changes in life, we need to kind of keep an eye and make sure that they have all the tools they need in their toolbox to deal with these challenges. So next slide. Oops, let's see. You're going to also encounter especially in if you're working with kids with intellectual disabilities, there's a fair number of syndromes where the child might be deaf, but they might, like, for example, like charge syndrome, the child might have like OCD related conditions. I think there's a charge symposium that WPSD is sponsoring. And so the condition of charge association, there's known mental health sequelae with that. And it doesn't mean just because you have charge, you have all these factors, but it means that you might have a higher risk of developing or having like an autism spectrum disorder that's related to the fact that you have charge rather than a separate syndrome. The genetic schizophrenia researchers really are keyed into velocardiofacial syndrome, because that particular syndrome has risk for development of psychosis. And so the genes for velocardiofacial syndrome are being really well analyzed by psychotic disorder researchers, and that often is most people that have velocardiofacial are deaf too. So these kind of things are really interesting in some ways, like Pendred syndrome, where you have thyroid disease and deafness. Anybody that has thyroid disease can have a higher incidence of anxiety or depression and so forth. So these kind of things important to keep in mind about the correlation between medical issues, etiology of deafness, and mental health. Not in a bad way, just as far as risk factors. So the other thing is that mental health conditions and one's risk for mental health conditions happen at certain points in time. Like, of course, postpartum depression. You're not going to get postpartum depression if you're not pregnant. If you have anxiety disorders, the likelihood of developing an anxiety disorder is greater when you're a kid, when you're like 10 years old, because that's when serotonin synapses are all doing their thing. Whereas psychotic disorders, people hear voices or experience different signals coming from them in different ways. It's because dopamine pruning happens when you're between 18 and 21. So these kind of symptoms, for the most part, develop at this particular time frame, whether you're deaf or hard of hearing or whatever. So these are also kind of things that change in childhood, a person's mental health symptoms. So, and then also, when a child has sensory differences, there's new stressors related to demands of the environment. One girl that I work with, who's blind, loved Zoom because she didn't have to worry about falling off the bus when she was coming down the stairs, or she didn't have to, wind up and down from math class to English class, 3 flights of stairs. So she loved Zoom. And she talked with her guidance counselor kind of about this. We worked together, and the guidance counselor helped her to have her classes more on one floor. But I don't think anybody, until she spoke up, was really aware of those challenges before COVID hit, and I don't even think the girl was, like, I think she was just doing her normal high school routine like everybody else. But then when she had an opportunity to not be moving around like that, she was like, oh my goodness gracious, this is wonderful, school in pajamas. I can actually see my teacher's face because the teacher's right there, and these kind of things that were so important to her, how to, continue that, or if it can't happen in high school, how to continue that when she goes in college. Like, is there a better way to be doing college for her based on her experiences over COVID? Let's see, next slide. So there's, of course, many diagnoses that I didn't put on here, but mostly, I don't even think I put the couple I should have put on here and didn't. So attention deficit disorder, I don't know why I left that one out, but attention deficit disorder is quite common among kids who are deaf, blind, and hard of hearing, both from the etiology of whatever caused their deafness, but also because they need different arrangements maybe of a classroom. Maybe they need to sit up front in order to hear what's going on. So attentional issues are really important to keep track of. That doesn't mean everybody needs medications, but you need to be sure that you optimize the kid's attention to task as much as possible, that you don't sit a hard of hearing kid next to a fan that's always running and then expect them to, be able to pay attention. And the kid might not even be aware of that as being a distractor to them. Adjustment reactions mean, like an adjustment disorder, they call it, has to do with like a stressor happened. And like this one girl that I was working with that I told you she prefers Zoom, it was an adjustment for her to come back to real classes. So she was quite depressed about the idea of coming back to real classes. So an adjustment means something happened in a kid's life and then negative emotional sequelae occurred. So depression and bipolar disorder, I should slow my rate down. I'm sorry, Mr. Interpreter, I apologize. So depression and bipolar disorder also tend to happen in the teenage years. That's when, just because of all the neuronal pruning and so forth, these kind of conditions tend to happen. And I mentioned about anxiety disorders and eating disorders, anorexia and bulimia tend to be in the adolescent years. And trauma-related disorders, like sometimes if a kid is hospitalized for an extended period of time, or maybe they had COVID or whatever, and then substance use disorders. Psychotic disorders, that's certainly in there. Psychosis can happen in the context of depression, can also be schizophrenia, but it's not common. Like you're going to see it maybe once every couple years, a psychotic disorder, but not like any kind of regular occurrence. But the most common conditions you'll probably see: mood disorders, anxiety disorders, and adjustment-related disorders. So what can you do about the kids that you work with, and things that you can do kind of increasing the emotional reserve of kids that I work with? So from working with kids who are deaf and hard of hearing, make sure that they're not alone at lunchtime. And if you get a sense that they are alone, is there something instead, so they don't feel like a loser, that they can do over lunchtime, to, help you in some way, or, do some task so that they're not either a target or feeling incompetent in any way socially, and make that child have a sense of accomplishment. I'm bringing out my daughter's physics teacher example. One of the things that he does, which I don't know, I just love this. Instead of having kids pick a group where the most popular kids are all together, he has the kids have popsicle sticks that they pull. So one popsicle stick says one popsicle stick says two. So all the twos get together and all the threes get together. And so there's never this sense of, oh, I got picked first, or I got picked last, or any of that kind of stuff. And you might do that already, but I thought it was kind of interesting coming from a physics teacher, and no diss to physics teachers out there, but I just kind of thought it was just a very sensitive move, and I really applaud him for that. You want to be sure that there's not bullying that you can do something about happening, and sometimes you don't even have to say anything about it, but maybe put the child nearer to you, or kind of intervene in some way to make the child who's being bullied feel a little bit more protected in some way. So nowadays too, for a hard of hearing kid who's hearing his teacher like this, it's really kind of difficult for tutoring to be successful many times. So being as how everybody's good with Zoom nowadays, is maybe the kid can do tutoring on Zoom with you, so they can speech read, or that they can actually use, or, I'm sure you guys all have the masks, the clear masks or the shield masks and that sort of stuff, to really optimize and be cognizant of how the kid is learning information best, and what barriers are frustrating to him. Even if he can hear you and he can't speech read, he's really using all his mental power to focus on reading you rather than thinking about his math, So these are kind of things to be keeping in mind. All right, next, classroom strategies. So one other thing, going back to the favorite physics teacher, is he opened the conversation in physics class. And I'm not sure what's going on in his life, but I know he's a dad. And he talked about, with the physics class, a little bit about what gives you joy in COVID. And kids said some crazy stuff, like my daughter said sleeping with the dog. Some kids said eating soup and then pulled soup and started to eat, and on their Zoom and so forth. And, like a whole interesting getting a bubble bath, taking a walk, all these kind of things. And then the next couple days later, he said, what sucks about COVID, So kids are openly talking about it as if it's okay to talk about this, it's okay to recognize that we're all not in our best space maybe, and so what are these stressors? What's good despite the bad, and like sort of making an open communication opportunity and making kids, whether they're blind or whether they're normal vision or deaf or normal hearing, everybody's in the same boat on that level, like COVID sucks and it's changed lots of things about people and the way they relate to people, and some more than others, but it gets common ground feeling for people, which I think is really important. So a lot of kids that I work with who are deaf or hard of hearing, who over COVID really learned a lot if they were insightful and if we worked with them to help them identify what they liked, really good at saying for themselves what strategies worked for them in the classroom. One kid that I work with who is from WPSD, has attention deficit disorder, and he was doing his classes on an iPad like Yo Big with his dog here and his drink here and like all kind of crap on his desk. And then in the other living room, he had this screen to play video games on that was like one would watch football on. And so we talked with him about like, why don't you do your classes over there? And he never like thought about it because usually whatever somebody else was using it, but he started doing his coursework on that. And his grades improved tremendously. And, he didn't have all the distractors in his desk. And now he uses that all the time, both for telehealth as well as for, kind of his classroom. Now he's back in real life. But Zoom was a really difficult thing for some people who had attention deficit disorder, especially if you're using a screen big. So kind of keeping in touch with what kind of seating arrangements the kids doing, whether they're in person or not in person, as well as kind of what technology works for them, stuff like that. And I think kids taught themselves a lot about technology, and sort of there's a lot of kids that reached out to other kids, like kids that they might have met in summer academy I'm aware of, and sort of networking about how to get through the need for assistive technology. And so I'm not sure how we can run with that, but the kids themselves probably know a lot more about technology in some instances than we do at our age. And so, kind of how to foster that and how to foster the strength of kids' skills with assistive technology and technology in general to help others who may be more challenged. During COVID, another thing that was interesting that happened again at my daughter's school is that one day, and they got parental consent for this, like they didn't say exactly the details, but they said they were going to talk to schools in like Australia and Spain because everybody was doing Zoom school. And so they did, and they talked to other kids in different environments, a little bit about like what their experience was like and how their country was dealing with this and that. And my daughter was really excited about it. I don't really know why, but just probably it was something different. And, they had interpreters and that sort of stuff and for other schools with different languages and so forth. But it made me think about, like, I don't know, since we try to do the summer academy and bring kids with low incidences together, blind kids being together for summer academy, if the idea of like schools could bring kids who are hard of hearing together on Zoom every once in a while or something like that. Like, I don't know, like the peer support concept, whether it happens in school or, you know, they have hearing loss association for older adults, but like the idea of like bringing kids together because it is a low incidence thing, and how to capture, I thought that was kind of brilliant how they did it, you know, the collaborative with the different schools about Zoom and how people were adjusting to Zoom. A lot of kids do like FaceTime and group chats and that kind of stuff that sometimes gets them into trouble, but how can we maybe think about fostering that in a positive way? So I think there's lots of things that already happen in that regard, but just to kind of think of that too, you know, as the whole explosion of technology use and how to use that in a positive way rather than a dating service always or that sort of thing. So next slide. So the girl that I was working with, who is blind and loved Zoom, really had a difficult time navigating the bus, and she felt very alone at lunch. And over COVID, I'm not even sure how it happened, and I'm not sure she knows exactly, but one of her neighbors who drives to the school started, when school restarted, she offered her to drive her to school. She doesn't get paid. They live in the same neighborhood and they're not exactly buddies or friends particularly, but this girl drives to school with this other high schooler. And so she doesn't have to worry about navigating the steps anymore. She doesn't have to worry about fumbling with her cane. She doesn't actually even use a cane usually. She doesn't have to worry about falling or tripping. And her level of anxiety and sense of inclusion is really much improved. Like, even though that girl isn't a friend, the other girl who drives her is sort of like her Uber driver without being paid. The other girl intends to get into a helping profession from what she describes. But they talk about like light things like the weather, and she'll sometimes practice with me things that she might ask this girl on the way in on the drive. But just kind of that, her having a buddy has really helped her emotional health. You know, she doesn't even take medicines, but having a person to look out for her rather than having to deal with these challenges alone. The girl herself, the individual who's blind, isn't someone who speaks up necessarily. Like, she doesn't use a cane. She doesn't want to have a hearing support dog. She doesn't want to call attention to herself in any way. She's just probably one of the best students in her particular high school. She really has benefited by that intervention of this particular girl riding her to school. She also goes to Vision Quest, and through Vision Quest, you know, that I think that's the name of it, Blind Sports, that she really has done very well in networking with other, and she used to go to Summer Academy. You know, so these kind of supports have really been something that she's grappled onto without having to ask for these kind of supports. So it really makes a difference in these kids' lives. I doubt you ever doubted it, but it really does make a difference. And so now that all this Zoom stuff is going on, is this something that can be done? Like, can somebody talk about their experiences? You know, like talk a little bit about how I had this problem when I was in high school, and now, you know, this is how I got through it and that sort of thing. There's a lot more opportunities maybe for that because there's Zoom going on nowadays. Let's see, I'm kind of looking at. Okay, next one. So I don't know if we want to open it up to if there's any chat conversations or other commentaries about ways that hearing or vision loss affected the mental health of people that you might be serving, or if there's, should we save that till the end maybe, or just talking about cases, or I didn't know.
This is Sue Ann. I can find my camera here. Yeah, I did not see anything come in the chat right now for specific questions.
Okay, we'll
But
sort of save like cases till the end. So if you're working in the field of deafness and hard of hearing and you don't know a lot about vision, it's kind of good to look at some of the resources that are out there about assistive technology for blind individuals, or talk to someone in VR who's blind, or somebody from Patan who is in that field, to learn a little bit about what assistive technology is out there for the thing that you're not familiar with, because there's lots of development in these areas. There's lots of development too in not just communication for ASL and hearing aids and so forth, but for kids who have autism spectrum disorders, and for the use of iPads for different programs that help people communicate who don't have good language in any modality except for showing pictures maybe and PECs and things like that. So it's good to consult other clinicians who can help in this way in an area that you're not really familiar. Like if you think a communication specialist could help you, or if you think, a speech language person can help you, they have them at your fingertips at schools. Or you can sort of investigate what people in your area do in these kind of things. So kind of next slide there. I think we'll move on to actually COVID factors, the one that says COVID. So among people that I saw this last year, huge about the mask wearing issue for hard of hearing people. It was really frustrating. I have a lady who has a lung cancer whose doctor refused to take her mask down. She refused to use a mask that's clear. And her life was in this, in jeopardy. Like she needs chemotherapy and she needs details and so forth. And so we sort of talked a little bit about what could be done, so I think some people, it's frustrating both in school and everywhere that the hard of hearing person goes, because it's not just an issue where people are needing to wear masks in the school, but in the healthcare setting, so they're not understanding anything going on in their environment. And when important information is there, needed to be had, it's very anxiety provoking for people to miss it, obviously, so that's presented a huge stressor for many of the people I see. I have another young guy who is an architect who's hard of hearing, and they had a lot of Zoom meetings, and this was before they learned about platforms with captioning and all the captioning that you can do on Zoom meetings. And so their meetings on Zoom weren't captioned. And it was about building buildings where he needed to know the details of things and needed precise information, and that wasn't available to him because he couldn't hear it and he couldn't see it. And so he ended up leaving that job, but it was really, really stressful for him. And he got a great job, unfortunately. So just, kind of a huge impact on people, like the fact of not being able to have technology that worked for them, or the issue of mask wearing and so forth. Kids, I'll talk about kids because we're talking about school, but kids behave differently too because of what their family has told them about COVID. And some people are hypervigilant and some people are cavalier. And so it's confusing, particularly to a child maybe who is hard of hearing or deaf and doesn't know the information from the CDC or from, the news, or doesn't know the right information. So they watch their kids do this, or not call them back for a play date, or not go to a big setting, and they're not real sure what's kind of going on. So information can help people with anxiety know what's going on. And that's an important resiliency that you can offer to them as to what you know about COVID and what the expectations are. We can't control whether we're doing Zoom or whether we're doing live, but we can say, this is how Zoom works. This is what the expectations are. If you need tutoring, do this. If you're doing live, let's do this, so that the kid has a paper that they know the plan of action. a lot of people had changes in their financial situation in their home, you know, and lots of changes in that, job loss of caregivers. So kids with intellectual disabilities might not have had nurses, or might not have had HAB aides or interveners or whatever, SSPs for the older folk, you know, and so these kind of in-home caregiver type of people really went away when COVID was active, and still it's really difficult to find people to man these jobs, or women these jobs, I guess, to play, you know, serve in these capacities, you know. So other risk factors of COVID for sure. So as a teacher, maybe we'll move on to the next slide. So I liked, going back to the physics teacher, kind of how he put it out there, didn't single anybody out, but things to be thinking about and openly talking about is what's going on, all y'all, in your life because of COVID. What's uniquely different now, and what's going on with COVID? Is the world going to hell in a handbasket? Are we going to be okay? You know, what's going on? And you know, kind of the getting the kids talking about, are they skilled at what do they like the remote classes? If so, what has helped them being, you know, get them talking, because kids listen a lot more to each other than they do listen to us as adults. So that's kind of, these sort of topics might be good to investigate. So then moving on to resource awareness, we'll talk a little bit about, okay, so if a kid is struggling, what are some strategies, both from a classroom perspective, a school perspective, as well as an individual perspective of what you might be able to do about that? So there's this program National Alliance of Mentally Ill does. If you go on their website, NAMI.org, National Alliance on Mental Illness, they do this program called Ending the Silence. And I don't know all the areas of Pennsylvania it exists in, but in Western Pennsylvania, it's pretty available, from although the Keystone NAMI chapter, which is the state organization. So they send out somebody who's like 22, 25, a couple people, and they are kids who actually look really cool, who talk a little bit about their struggles. Maybe one lady, I went to a couple of them because I was kind of curious of how it looked. One lady fought in Afghanistan for like a year, and then she developed bipolar illness. And she had a lot of cool stories about Afghanistan, you know, that got the kids all, and all the cool foods, you know, and different things in the service, and how she learned this and that. And then she talked about, you know, all the pop artists that have had, you know, suicidal ideation or attempts, or, you know, she brought it to a teenage level, you know, which was really kind of very good in a way that's totally destigmatizing. And it was to a group of, you know, maybe 30 kids, you know. I think it was a gym class, or, you know, one of those kind of forums where they nowadays talk openly about mental health more. And so, you know, NAMI does this for free as part of a public service kind of thing. And so these kind of symposiums where you openly get people talking about it's okay to struggle sometimes, and help is out there, you know. So actually NAMI is a place to turn to if you or the kids you serve. It's a resource opportunity too. They make a point of knowing, if you call whatever chapters in your area on their website, they'll be able to tell you, you know, where you can get help for a mental health condition. Next slide. So over COVID, it was kind of, I'm sure you guys experienced it too. And I think probably in a school setting, it's more awkward, but in a health setting for counseling related fields, telehealth took the world by storm. So probably 70% of my caseload still does telehealth, and there's nobody gonna want to come back into the office. Like for people who are doing relatively well, I am seeing people from Philadelphia area, from Scranton, because especially seeing kids who are deaf or hard of hearing, it's hard to find service providers in that area. So most mental health care providers in particular are still, and probably will hopefully forever, be able to offer telehealth. It's not always the best option for certain people. And I still prefer to meet a person live in person, usually when they're really sick, like for the first time, or even I do feel more bonded. But for somebody who's doing well, or we're titrating some medicines or offering some support, kids don't care. Kids are way cool with the idea of this kind of social media-ish kind of thing. And so probably it was our awkwardness, about it at first, and it's actually easier to involve the parents sometimes with this kind of modality of telehealth, without being so open about it, just to say, hey, can I talk to your mom for a sec? Rather than, it's also easier because the kid doesn't have to rely on their parents for transportation to get to appointments. And, for specialty, like not all mental health facilities really dig working with hard of hearing kids or deaf blind kids. So the agencies and private practitioners who work with deaf and deaf blind and hard of hearing kids have really blown up in regards to their practice numbers. And so that's been a very positive thing. I think it's really led to, destigmatizing, I guess that's a word. So it's a lot, I get phone calls from, I remember somebody called me from the Big Butler Fair on top of a Ferris wheel because they thought it would be cool if I saw that, and okay, but don't jump, so, these kind of things really made people, it brought us into their world a lot more, and not that I necessarily think that's something that we want to foster, that kids are real cavalier about getting mental health care. But, that was important for that kid to show me that for some reason, and not in a bad way. He wanted me to share in the enjoyment of his enjoyment, and, I've met more dogs and cats and, so forth. And people want to share their life a little bit more, which isn't so wonderful maybe for school, but for mental health, when a person needs support, you want to offer it in whatever way is accessible to them. And not that, I think a hybrid model for mental health is what all of us who are mental health practitioners are really aiming for. But the opportunity for telehealth really kiboshed some of the barriers that, like driving for a blind person, getting in access if they need access, if they're transition age. And, so we see people from really remote areas now who are blind, who wouldn't be able to come into the office easily, both because access wasn't working during COVID early on. And, for now, they're even doing phone opportunities, not just video, but eventually that'll probably change. But the bottom line is accessibility for mental health services is much easier than it was a year ago. So next one. Oh, the one thing that's bad is the in-home service thing. In-home services like wraparound and family-based got much harder to get. And for people with intellectual disabilities, not necessarily for kids, but for adults with intellectual disabilities, the day program shut down. Still, there's all these problems with people testing positive, and what the heck do they do? Staffing shortages everywhere. So for the segment of people who need psychiatric and counseling services, telehealth has played a very important role. But for people who really need CTT services or in-home services, or, that person-to-person kind of stuff, that really took a hit in a big way. So just kind of differences, but just I wanted to call attention to the fact that, COVID had some positives in regards to people's perception about telehealth, about the potential of, conferences, connecting with other professionals, having a consultation. Psychiatrists now consult regularly. Maybe we get zoomed into a pediatric office on screen. That kind of stuff just got real prominent over the course of the last year, I just got an email today asking if I did psychiatric services to South Dakota School for the Deaf, and I'm thinking, huh? So, it's not necessarily that it's wise to jump on all these things, because certainly, there's lots of variables. And sometimes if you don't know the resources in the area, that's no good. But nonetheless, there's certainly going to be a place for this hybrid model of care that we're trying to encourage. Next, I want to talk about the stress on all of us as adults. So we, of course, and you have had to do crazy things in the last year or two, like in regards to trying to keep yourself and your family afloat and trying to also serve the needs of kids. And particularly if you're a parent yourself, or even if you have doggies and cats and, family members and parents with you, we're all not just ourselves. We haven't come to this with a network of people who are dependent on us. And so sometimes that balance has not been easy for those of us adults too. And so it's important to use these same sort of practices and know that help is available for you too. On the back of your insurance card, there's a member services number. You can always call that member services number, like if you're looking for a counselor, or that kind of thing. And also to have like support groups with each other, like we do that at my work site. We had one the other day that probably the administrator who fostered that was probably a little sad that he had that meeting, but because we were all sort of like probably a little more negative than maybe we should have been, because everybody's working their butt, and that's the same for you as teachers too. But it's important to have an opportunity to vent to somebody what you're going through and the craziness in the world at this time. Whether it's your spouse, or whether it's a little think tank group, or whether it's Sue Ann Hauser or something like that. I don't know, but like it's important to kind of put it out there sometimes. So just to say that piece too. I wanted to move on to the Health Bridges directory, if I might. So on that, and I'm not sure if you can go to that link. So if you're looking for mental health counselors who just deal with culturally deaf people or hard of hearing people or blind, that list of providers, I think there's about 10 in Western Pennsylvania, but all of them are doing telehealth. Some of them are agencies, some of them are private practitioners, some of them are doing counseling, some are, like I do medicine management and assessments as a psychiatrist, and some of them are group homes, like Partners is a group home, Presley Ridge is an emotional support for deaf individuals. So they all have a little service description there. But good to have that Health Bridges thing there too, because I think the insurance companies kind of have a copy of this too, but just so you have it as well. So I think we just have 5 minutes left. I don't know if you want me to take a few questions or go over the last couple slides, whatever.
I don't, this is Sue Ann. I don't know that we've had any specific questions coming in. I think folks are really soaking up what you're sharing. So if you want to cover the last couple of slides, I think that'd be great.
Okay. So this has also evolved over the course of the last couple years. These are all collaborative kind of things, like most pediatricians, or I don't want to say most because I'm only aware of Western Pennsylvania, but some of the bigger practices in Western Pennsylvania all have social workers and consultants. It's called the TIPS program that I think UPMC might sponsor. So psychiatrists can be beamed into pediatric offices, or there's social workers more. And these kind of things is one way, not for a person maybe who had schizophrenia, or maybe not the best thing for a hard of hearing kid who's dealing with, issues related to Zoom, but to identify depression and then maybe refer them, that sort of thing. And so other schools have a person planted, from like say Milestone or Mercy Behavioral Health works in some of the schools in Pittsburgh Public School. So there's a counselor embedded there. some of those counselors may or may not know what you know about kids with sensory differences, but it's good that you can sit down and collaborate with them or ask them for a moment of their time and, you know, kind of like get their sense on the mental health end of things. Your school social worker might be another place to turn, you know, and then that list of private practitioners that I told you about. So then the next slide, as to kind of collaborating. So when a kid is in mental health services, when they've made that connection to mental health services, of course you have to have the release of information in order to collaborate with people. But usually mental health professionals really want to collaborate. You know, if you have the time, everybody's got a crazy schedule. Teachers can't be interrupted, and you know, mental health professionals too, they have their schedule and clients and stuff. So sometimes it ends up being like, you know, a quick phone call at 7:30, or, you know, like it has to be brief usually and that sort of thing. But if you have like an ISP or an IEP meeting or something, you want to send a summary report, you know, or in some way, if especially if a kid's not doing well and you want the mental health person's attention, you know, maybe go through the family, get a release signed and see what you can do, you know, to share your perspectives. Because you realize that sometimes I lost my train of thought, sorry. Sometimes when people come into the office, they're actually only thinking about, like, parents only thinking about their perspective. Like, they're not necessarily thinking about school and how school going and all the variables there. So that's important information that we might not otherwise hear. Let me address this question here.
So this is Sue Ann. The participants cannot see that question.
Oh, okay. So the question is, I work with a student who's the only deaf student in her building. She's desperately wanting to connect with other deaf students her own age. Social media is great. However, parents are leery of her accessing that. Do you know of any social media groups that are kid friendly? And I don't know if any of you guys also have some thoughts on that, but I wonder about developing something like that, honestly. So the kids that go to the summer academy do keep in touch with each other sometimes in between, from what I understand. And I don't know if you want to comment on that, Suan?
Sorry about that. I was reading another thing that came in, so you snagged me not really paying attention.
Sorry. Oh, you know, I was talking about like some of the kids at Summer Academy, you know, even though Summer Academy didn't happen last year, some of those kids kept in touch with each other anyway. Like, I was aware of one kid who's deafblind told me that's where she learned like some of the video strategies is from somebody else across the state.
Yes, so students who are able to join that Summer Academy, and most of you will know what that is. You know, Kim is absolutely right. That network has stayed strong even after they're no longer connected through being online, or even when they are able to get face-to-face.
So if a new kid, I don't know how you would address a new kid who might not have ever gone, you know?
Yeah, that is, you know, and that's where I think it's going to be helpful for us to help lead them, find them some other groups, reaching out through the National Deaf Center, finding out if there are other groups that way. Many of you are on the listserv for the National Deaf Center too. So if it's something that is Pennsylvania specific, I don't know that we have anything that I can certainly point people to directly, but the larger community just might. All right, Kim, is there any last thoughts for folks?
No, I think there's just a lot of Cool. I've always really enjoyed working the mental health end of deaf, blind, hard of hearing, because there's all so many variables and so many balls in the air, and so much opportunity to collaborate and think together, because it's never like one thing or another. It's never like you know, it's just this one thing. It's a lot of things. You, as a provider team, we need to think about like the resiliency of people in preventing mental health. And also, when a kid is struggling, it's never usually just one thing that needs fixed. There's like 6 things that we can all collaborate on. So it is a lot more, there's a lot more need for thinking collectively about the care of these kids.
Yes, absolutely. And you know, one of the things I was receiving was that this is really good. This information is what some folks are very hungry for. So thank you
Oh,
for
thank you.
bringing this to our network. And for those of you who were asking about handouts and so forth, the presentation, I'm going to ask one of our support folks to send it to everyone who attended. And then also, when this gets formatted and posted to the website, we will make sure that the handout, the PowerPoint, is attached to that, so you can also download it from there. So I want to thank you, Dr. Mathos. This was fabulous. I think we could use a part 2 and 3 from what I'm hearing. And that's great feedback. You'll see in the chat that today's evaluation link is listed there, and that the exit code you need to enter to get credit is SMH. The letters SMH.